Okay, RBT exam practice questions, part 7. If you're enjoying these videos, please like and subscribe. It really helps me, shows me some support. If you want more of our study materials, more videos, check out our website. I also have the links to all our study materials on this slide. I'll put those links in the comments below and the descriptions below. So you have easy access. We also have the full RBT task list video on my channel. Check that out. Full mock exam review on my channel. Check that out. Other than that, let's get going. Okay, so people have been asking for more graphing questions. Here to tell you, you do not need to be worried about graphing on the exam. Okay, there might be 1 or 2 questions at the most, right? They're not going to test you too hard on graphs. Okay, but just to ease the anxiety, I want to go over a few more. Okay, to show you how easy they are. All right. So even this question is a little more difficult. Okay, but as long as you know your vocabulary, it should be a layup. Okay, so the baseline data is following what trend? All right, so as long as you know what baseline data is, this question's easy. So is our baseline data here? Okay, 1 through 4 or 5 through 8? Okay, if you've been looking at your definitions, you know it's 1 through 4. Baseline data comes before intervention. This line shows us it separates baseline from intervention. Okay, so we know our baseline data. Is this line increasing? Is it decreasing? Or is there no trend? Okay, and that's all trend is asking, right? It's not more complicated than that. Is the line going up? Is it going down? Is it flat? This line is flat, right? So let's look at our answer choices. Increasing, no, right? Flat. Decreasing, no. C, no trend. Okay, so the baseline data, there is no trend. In baseline data, that's what we want. We want no trend in baseline. Once we have no trend in baseline, we can move on to intervention. Okay, so the answer is C. Okay, another graphing question. How many data points were collected in baseline? Again, if you know your definitions, if you know what baseline is, this is a very straightforward, simple question. Okay, so same idea. Which one is baseline? Is it 1 through 4, 5 through 8? It's 1 through 4, okay, before our intervention, okay? So how many data points? How many data points do we have? Well, you might say, well, there's no explicit data points. How do I know that? Well, all you need to do is go down here and look at your x-axis, okay? We have 1, 2, 3, 4, okay? So that's it, right? How many is that? 4. So the answer is 4. Graphing is really that straightforward, right? All the information you need is on the graph. Okay, so you don't need to try to figure things out when the information is right there. Okay, so as long as you know the difference between baseline and an intervention, okay, and you know what goes on the y-axis and the x-axis, you're going to be just fine. Okay, they might ask you 1 or 2 questions. That's it. Graphing very easy, very straightforward on the RBT exam. Don't get nervous about graphing. Okay. All right, so you're sitting at a table across from your client. In one hand, you're holding a Barbie doll. In the other hand, you're holding an iPad. You tell your client, pick one. What type of preference assessment is this? Okay, so let's think about it. You need to know 4 types, okay, of preference assessments for the RBT exam. Okay, you have your single choice, you have your forced choice, you have a multiple stimulus with replacement, and a multiple stimulus without replacement. Okay, so if you have a single choice, right, what is that? It's exactly what it sounds like. You have one item, and you're just trying to see if your client will take it from you. Usually, this is very early learners. Okay, very early on in development. Okay, you offer them one item and just see if they'll take it. Okay, forced choice, you have 2 items. Okay, and you hold them out, and you have your client pick between one of the 2 items. Okay, that's forced choice. And then multiple stimulus with and without replacement. Okay, that is 3 or more items. Okay, in an array and on a table or however you're doing it. Okay, 3 or more items, and you have your client pick one. Okay, so in this situation, what are you doing? You have a Barbie doll in one hand and an iPad in the other. How many items do you have? You have 2 items. You're forcing your client to pick out of the 2 items. Therefore, is it A, naturalistic, No, this is very contrived, right? You're at a table, you're contriving the whole situation. B, multiple stimulus with replacement. How many items do we have? We have 2 items, okay? Dead giveaway. If you have 2 items, that is not multiple stimulus. Multiple stimulus, okay, is 3 or more. B is out. C, multiple stimulus. Again, we have 2 items, okay? Multiple stimulus would be 3 or more. D, forced choice. Yes. D, we have 2 items. You're forcing them to choose between the 2 items. Therefore, we're doing a forced choice preference assessment, okay? Remember, your giveaways are forced choice is 2 items. Multiple stimulus is 3 or more, okay? If you remember that, you should get these questions correct. You're watching Hulu and an ad for Flaming Hot Cheetos is shown. Suddenly, you start to crave Flaming Hot Cheetos. The commercial is a what? Is it an MO, an SD, positive reinforcement, negative reinforcement? So if you've been watching the videos and studying, okay, you should automatically rule out C and D. Why? Because we're not talking about any sort of change in behavior, okay? We're not talking about an increase in our future behavior, okay? We're not talking about a consequence, right? So it can't be one of these reinforcements, all right? So C and D are out. What happened, okay? You saw an ad and suddenly you start to crave Cheetos, okay? What does that mean? Well, now you want Cheetos. Okay, what did we learn in our last video? We learned that an MO makes you want or not want something. Okay, it alters the value of a reinforcer. Okay, and what does an SD do? An SD just says this is available. Okay, so did the commercial make you want it, or did it say it was available? All the commercial did was make you want it. Okay, so A is our answer. Why is it not B? Well, just because you see a commercial doesn't mean it's available to you. If I see a commercial for a BMW, okay, I might want the BMW, but the commercial is not saying it's available. It's just making me want the BMW, okay? If I have enough money and I go to a car dealership and then I see the BMW and I can buy it, okay, then we can talk about SDs. But in this situation, all the commercial did was make you want it more. Therefore, it's an MO, okay? It's not saying it's available, so it's not an SD. We're not talking about an increase in future behavior, okay? So it can't be reinforcement. A is our answer. During supervision, your BCBA states that you are incorrectly running an imitation program. She explains how you should be doing it and models it. How should you respond to this feedback? Okay, so totally appropriate BCBA supervision. Okay, they see you're doing something, they want you to change it, and they think you can do it better. Okay, so they show you how to do it. How should you respond to feedback? Okay, A, quit. Your BCBA has no right to tell you how to run your programs. Now, that's just not the right way to approach it. Okay, your BCBA does have a right to tell you how to run the programs. Remember, ultimately, the BCBA is responsible for your client, or your supervisor is responsible for the client. They're responsible for the treatment plan. They're responsible for the outcomes. Okay, you're there to implement and assist in a valuable part of the team. But whatever happens to that client ultimately is going to reflect back on them. Okay, so if they want you to run a program in a certain way, okay, you need to at least try. So don't just quit when you're given feedback. Okay, all they're trying to do is make you better. We want to make you better because remember, it's not about you, it's not about us, it's about the client. B, roll your eyes and complain about it in secret to your coworkers. You can choose to do that, okay, but does that help the team? Does that help the client? Might make you feel better temporarily, okay, but does that help what we're trying to achieve? No, okay. C, accept the feedback and attempt to implement it. Your BCBA is only trying to make you better. C is good, right? You should just look at it as an opportunity to improve, okay? The better you are, the better the outcomes of the client, right? So if you can accept the feedback and at least attempt to try to implement it, okay, you're only going to get better. Now, if you implement it and it's still not working, then maybe you can have a discussion with the BCBA. But at least try, okay, make an effort to try to implement it, okay? So C looks pretty good. D, accept the feedback, but then continue doing it your way when the BCBA is gone. No, you should at least attempt to try whatever they suggest, okay? If it doesn't work, then you can restart the conversation and say, hey, I tried it. It didn't work. What else can we do, okay? But ultimately, C, accept the feedback, attempt to implement it, okay? All they're trying to do is make you better. All right, another graphing question. What is on the y-axis in this graph? you know what the y-axis is, this question should take you 10 seconds. So is this the y-axis down here, or is this the y-axis? Okay. Remember, on the left, okay, the vertical axis is the y-axis. What goes on the y-axis? Your behavior. Okay. What is our behavior? Frequency of self-injury. What is our answer? A. Graphing is that simple, guys. It's right on the graph. Okay. They're not trying to trick you. All the data you need. That's the beauty of a graph. Is it's easy to read, easy to understand. You can show it to parents. You can show it to a ignorant or naive learner, and they can read it. Okay. They're not trying to trick you. As long as you know that a y-axis is the vertical and behavior goes on that, the x-axis is horizontal and time goes on that, you're fine, okay? So what is on the y-axis? Behavior, frequency of self-injury. Brian picks 6 items out for his client. He places them in a row on a table and instructs his client to pick one. His client selects the Mickey Mouse doll. Brian puts the Mickey Mouse doll back on the table and replaces the other 5 items with new items. What type of preference assessment is this? Okay, so a couple things. You see a long question, don't panic, okay? If you read a long question and you're in the middle of the exam and you start to feel anxiety, skip it, okay? You have plenty of time, right? So if this is going to give you anxiety to read this long question and you're confused, go on to the next one, finish your exam, do the ones you know, come back to it, okay? That's perfectly fine, right? You have plenty of time, okay? But this is not that difficult of a question if, okay, we know our preference assessments, right? So what is Brian doing? First off, he has 6 items. So immediately, we just talked about it. What does that tell you? What kind of assessment does it have to be? Well, it has to be one of the multiple stimulus, right? Because it's 3 or more. It's not forced choice, okay? It's not naturalistic. Forced choice is 2, naturalistic. We don't have a set at a table, right? And then it's not single choice because it's not 1. 3 or more in a contrived setting, it has to be multiple stimulus. So we've narrowed it down. What does he do now? He puts them down. The client picks one, okay? He takes the item the client picked, he puts it back and replaces all the other items. What is he doing, right? Is it multiple stimulus with replacement or without? Well, is he replacing? Yes. Okay. So therefore, what does it have to be? It has to be multiple stimulus with replacement. Okay. Whatever the client picks, you put it back and then you replace all the other items. Without replacement, whatever the client picks, you just take away and you leave the other 5, you leave the other items. Okay. So in this situation, if the client picked the Mickey Mouse doll, you would just take the Mickey Mouse doll out and have them pick from the remaining 5 items. Okay. Very straightforward. Know your definitions. Know your definitions. This question gets a lot easier. But if you're stressed out and you're getting anxious on the exam, go on to the next question. Do what you know. Come back. You have plenty of time. Okay. You've been working on colors with your client for 1 month. Your client finally mastered red and blue. Your BCBA instructs you to run red and blue targets once a week instead of every session. What is your BCBA trying to assess? Okay. So they got red and blue down. We know they know it. Okay. So instead of running it all the time, we just want you to run it once a week. Okay. I just want to see it once a week. What am I looking for? Am I looking for maintenance? Yeah, I think so, right? I want to see if we stop explicitly training this skill. Is it going to persist? Okay. Are they going to be able to maintain that skill even without constant training? Okay. And so by running it once a week, we can at least see, okay, did they remember how to do it? Okay. So think about yourself, right? If you learn to do something and then you don't do it for months at a time, what happens? Well, you slowly get worse at it, right? You slowly, okay, maybe you forget how to do it or your ability decreases. So that's what we're testing for here. Can they maintain that skill without constant training? Okay. Remember, always read the rest of your questions or answer choices. B, generalization. Are we generalizing anything here? No, we're not generalizing to any other stimuli or people. So B is out. Stimulus control. Okay, are we changing stimulus control? Is red and blue coming under control of something else? No, we're just looking to see, okay, can they still identify red and blue? C is out. D, preference assessment. Are we assessing any preferences? Are we trying to figure out what they like? No. What are we doing? We just want to see if they can maintain their level of skill without constant training. Okay. Okay, Susie is playing a board game with her brother. Mom walks into the living room and says, "Okay, Susie, time for a bath." Susie immediately runs into her room and closes the door. Mom calmly follows Susie into her room. What is the SD in the situation? This is a great ABA question. Okay, it has a little of everything. Sorry about that. Has a little bit of everything. Okay, and it's asking you to identify the antecedent, the behavior, and the consequence. Okay, so let's break it down. Susie is playing a board game with her brother. All right, Mom walks into the living room and says, "Okay, Susie, time for a bath." Okay, all right. So already, what should you be thinking? What is my antecedent? Okay, or really, you should start. Who am I looking at? Whose behavior am I looking at? Right. Okay. So we are looking at Susie's behavior. Okay. So what did Susie do? Susie immediately ran into her room and closed the door. So that's our behavior, right? So Susie running into her room and closing the door, that's our behavior. So let's find our antecedent. What is our antecedent? What came directly before Susie running into her room? Okay. Was she playing the board game? She was, but was that right before? No. What happened? What happened after that? Mom walked into the room. But was that right before? No. What happened after that? Mom said, "Okay, Susie, time for a bath." So what happened right before Susie ran into her room was mom saying, "Time for a bath." Okay. So don't get confused, right? Whatever happens directly, immediately before the behavior, that is your antecedent. And in this situation, okay, what is your SD? Whatever happened right before the behavior. Mom said, "Susie, time for a bath." Okay, that's your SD. All right, so let's look at our answer choices. Mom walks into the living room. Okay, that's a tricky question. Okay, it looks good because it did happen before the behavior, but something happened after that, right? So mom may function as an MO here. We're just unsure, right? But why is mom walking into the living room not an SD? Okay, because mom walking into the living room doesn't signal that it's bath time. Okay, mom might just be walking into the living room to check on them or do a million other things, right? Only when mom says, "Okay, Susie, time for a bath," is bath time signaled. And that is the key, right? SD signals, okay, something is available. Only when mom says, "Susie, time for a bath," is bath time signaled as available. Okay, therefore that's your SD. Now, just for the sake of argument, what is our consequence here? Mom calmly follows Susie into her room. Okay, so real quick, antecedent SD. Okay, Susie, time for a bath. B, behavior. Susie immediately runs into her room and closes the door. C, consequence. Mom calmly follows Susie into her room. This is a good question. Okay, if you're good at this question, okay, you've got a good shot at the exam. This really tests your knowledge, okay, of breaking down situations. Okay. All right. So part 8 coming next week. All right. Look at our materials. Keep studying hard. You can do it. Okay. All only takes effort. Remember, learn your terms, learn your definitions. The better you know your terms and definitions, the easier the test gets. Okay. Thanks for the support. Like and subscribe, and keep studying hard.